We often want to talk about, like, when do we start this? And I alluded to earlier that Dr. Perles is very brilliant in that he talks about it very early at 28 weeks and says don't start, but get familiar with the concepts. And that readies, if baby does come early, that mom is ready with first hour expression and going to have much better breast milk outcomes in the NICU, as well as have more colostrum available for that oral immune therapy that is starting to trend in the neonate world. So he starts at 28 weeks. Some doctors will tie it to the 35-week GBS swab, and that's when they'll remember to give out the kit and say, you know, you can start this next week. And so at 36 weeks, women will do a session of 5-10 minutes in the shower. Like, it's just about getting to know your breast at that point. It's not about what you're collecting. And then we find that usually around 37, 38 weeks, they actually are having volumes that are collectible. Research is showing that basically some moms will get nothing, and we have to really be encouraging to them that even if they're not harvesting anything, they're still laying down the pathways for milk making. And so the average is 0 to 5 mils total time they do it. You'll get some who will do much more than that, but some who will for sure be that 0. So at that 37 weeks, what we suggest is 3-4 times a day for 10-15 minutes, mums do hand expression, and then we provide them with the tools in our kit to safely store, label, and transport to the hospital.
And Neda, I oftentimes, even though I tell patients it's safe, a lot of patients do not want to harvest their colostrum because they think they're going to run out of colostrum. So for those patients, I just say, you know what, just get to know your breasts and just massage them, just to give them the message that something is coming, get the factory going, recruit the cells that will actually produce the colostrum and ultimately breast milk.
And that was something that even a lot of healthcare providers were concerned about when we first started, is like the idea of, will you rob the colostrum? But the interesting thing is that absolutely we will not do that, because colostrum continues to be made, and what triggers milk, the mature milk, to come in is actually delivery of the placenta. So when we think of kind of the bigger world and the bigger perspective, we probably as mammals were the only ones that were saying it was normal to have colostrum for 3 to 5 days. Every other mammal is about 24 hours that they have colostrum. And so colostrum's job is kind of done, but if you think of a lot of other mammals, those babies walk to the breast within a half an hour. So it makes sense to me that our babies need a little bit of support, but we're certainly not robbing the colostrum, and colostrum will continue to be made for the appropriate amount of time.
Yeah, and it's so useful for those patients who do collect or harvest their colostrum. You know, we know that labor is the ultimate unpredictable thing. You can come with a birth plan, you can come with your best intentions, but the reality is you have to sort of go with the flow. And it's those patients who has more difficult experiences and cannot breastfeed immediately, it's so reassuring for them if they have colostrum to actually give that to their babies, so they still get all the benefits, you know. And I think that's the great thing about this.